I'm just going to kick off with a few questions for the first speaker, Richard, if that's okay with everybody. There's a statement coming through from Nada Abdul Rahman Gadala from one of the Khartoum, University of Khartoum Parasitology and Medical Entomology, asking that she's realized that Sudan doesn't seem to be one of the countries that Mentor Initiative work on, although there is a huge need for these initiatives here. I hope there's a future collaboration. So I suppose the question to you, Richard, is, do you have a footprint in Sudan? Is that a country you're looking to expand into? And are there room for bringing on board people like NADA in terms of that university structure there within Sudan?
Well, thank you very much for the question. You'll see we've had a long history in South Sudan, but Sudan itself, we were planning on coming to this year, and earlier in the year, we were hit by what's been a global contraction of international emergency funding by some of the big governments. And whilst WHO and Ministry of Health were extremely welcoming at Khartoum level to bring us in and to help respond to some of the refugee and other urgent needs on the ground for disease control, where there is much dengue and other Aedes-borne diseases. Yeah, we've not been able to move this year yet because of the funding contraction, and we're focusing on other countries where we are able and funded. We very sincerely hope to be in Sudan next year or later this year if the funding picture changes, but we are kind of at government's mercy.
That's a great answer, Richard, and very topical in terms of these overseas development aid cuts that everyone's experiencing here, at least in Europe. It's very interesting because we've actually got an interview with Nada lined up. She said in terms of the kind of Sudanese experience of dengue, we're looking at kind of pulling that into an interview piece for the next, to release the next few days. So I really hope you guys keep in contact. I hope that leads to some kind of, facilitation of your involvement in Sudan. So that's something to watch out for in the future. There's a question from Dr. Khurram Wahid. He, in terms of Richard, your presentation, I suppose it's some of Rachel's presentation as well, novel tools in terms of usage in other parts of the world. I suppose he's hinting at the rationale behind that. I'd expand that. He's mentioned, you're saying that they're easy to use and economical. You said at the beginning of your particular presentation, Richard, that you were an opponent of, or you were against facial repellents when they first started. What changed your mind? Because that's a very detailed work you're putting out there in terms of envelope, mesh, and Sumilov, 2MR, and some huge actors with you, SC Johnson, massive global multinational, and Sumitomo to the same degree. So what changed your mind in terms of spatial repellents, their use in these settings?
Well, it's probably my own personal limitations. No, I think there's two things. What I said at the beginning is that tools have to fit the context we're operating in and that people find themselves living in. 10 years ago, we didn't have either of those tools at the same levels of technical development. So our spatial repellents were at a very early stage. They were very, very short lasting in repellency effect and difficult operationally to conceive how you could continuously provide them or reuse them. It's about a balance of getting a tool which is both easy to use and has a durable residual life. They're now getting to the stage where at 1 month they're usable and changeable because they're so simple and light and easy to fly into a country at low cost and to distribute simply at low cost, even through local supply channels. But when they move to tools like mesh and have a 6-month life cycle, then that really is a game changer because it's still incredibly light to travel, to ship and cargo haul all over the world, and very, very easy to deploy and quickly to teach people how to use them. And in fact, we're both for that and for Sumilov, the 2MR, which is just this simple disc, it changes everything from using liquids and powders and granules into something that doesn't require any dosaging. It's a real simple pop a disc into the tank and the job is done. So it's about making it simple, but also turning it from something that kills vectors for a couple of weeks into something that works for many months, yet has a minimal cost ratio to that added gain. So really that's what's changed my mind, is the stage of the tool's evolution. These two companies have done a lot of work, as some of the others have in the past, to really push on new technology. And we're just reaching the horizon where it's got real applicability to very, very difficult settings to work in. And its simplicity is what makes it hold the promise of being robust and versatile in the way we use it, both in shelters and households. If it works in these settings, rest assured it will work in southern France.
That was exactly my next question, that obviously you're referring to access issues, as it were, in very certain discrete settings. You mentioned these camps that you work in, the emergency settings, war, conflict, emergencies. But what would be the next steps if it works there? That was actually going to be the question. You mentioned the south of France. I mean, do you envisage this? I know there are papers in play. I know that I think there's even a preprint of a paper. You know, you're building the case for these interventions. How do you envisage that rolling out? Let's say it's successful, which I'm sure it will be. How do you think that will be? What do you think the next steps will be?
We've got a fantastically developed commercial marketplace across Europe. We've also got a fantastic urbanization across Europe and a fantastic spread of ADs across Europe, with picking up more and more cases of disease transmission, not just dengue, but chikungunya and some of the others as well. So that fantastic local marketplace for going into your do-it-yourself shop or your agricultural shop and buying something is now getting to prime time, that if these tools are proven to work well in the tougher settings, you could imagine these coming online, being available to the normal householder through the normal hardware store in Italy, in France, in Spain, for their use at home in a way that governments won't be able to pick up and do for them on national scales, because we don't do that in the West, but where it will be transposable to be usable at the household level in the West as well, in Europe, and will be needed. It's not just because I'm going to retire in France, it's really because we've got to meet people's needs where they are.
That's a great answer. And I think it's elicited quite a few kind of prompts from the audience as well. So we've had a student, I believe Kefas Shitar Babale, he's saying, does your answer on Sudan also apply to Nigeria? I'm a Nigerian student studying in Malaysia. Are there any forms of collaborations, not even necessarily in dengue, but for your work for Nigeria? So do you have a footprint in Nigeria? Is that a country that you're going to, you mentioned it in your presentation, are you going to be expanding that work?
Yeah, happy news there. We were already funded before the government's cut back. And we began late last year, and we're fully operational in Borno State, the conflict area in the north. We're doing vector-borne disease control across displaced people's camps and across some of the most insecure host communities, which you can only reach by helicopter. So we have a full operational team. We're expanding. We're well supported by international donors to start building up and scaling up. We've got a great partnership with the Ministry of Health in Nigeria, and happy days. We look forward to really expanding, because there are many people in Nigeria, hugely diverse contexts and many needs, and hopefully we'll be able to expand and meet some of them with good partnerships across the country.
That's a fantastic answer, and it's really good to know that. And I'm sure that the audience will be happy to hear that. I'm sure they can contact you directly with any further questions or through the Mentor Initiative and your various programs in geography. So thank you for answering those. Kind of a clap there in terms of your comment on southern France from someone in France, from Dr. Ivana Balta in France. That's good as well. Coming to Rachel, the second presenter, Dr. Rachel Lowe. Richard just mentioned some of the cuts there, and obviously that's a part of the reality of living here in the UK. We've certainly, everybody's kind of up in arms about those. And you mentioned, why I'm mentioning that, is that you mentioned at the onset of your talk, Rachel, that your models will have a useful role in policy, and certainly in policy making, policymakers, think tanks, the policy world. Could not agree more. You mentioned this kind of, it could be the pivot between a, how to put it, reactive national surveillance system to a proactive, predictive kind of form of dengue outbreak prediction. Your work could be that pivot. I suppose the question I wanted to ask is, will this require a kind of a shift in approach and methodology as a modeler right from the start, i.e., do you make the model and then you find the policymakers, or is it time now, given the evidence that you're generating, the papers that you're publishing, the direction of work, the scaling of it from this island state thing to the Brazil scale up, and the positive stuff that all the positive kind of ticks that you're ticking along the way? Is it time now to involve these policymakers from the start?
Yeah, I would say that ever since I started working in this field, it's been very stakeholder driven. So I started this work as part of a European Brazilian collaboration, trying to include seasonal climate forecasts in different impact areas for society. And it was very much involving the Brazilian Ministry of Health. And that's why when they asked us to develop a model for them when they needed it, we sort of had everything in place because we've been working with them to design the models. And the same goes for our work in the Caribbean. We've been working since 2017, and our project, before we started the modeling, we conducted stakeholder engagement interviews and surveys to really understand the sort of needs and perceptions of our users. And also in Vietnam, it's been very much driven by that. And we've had interpreters and translators involved to make sure that we're really developing something that can be used by the users. So I would consider our approach to be very stakeholder driven, and we try and make it as simple as possible to meet the need, given all the compromises you have to make between using forecast climate information combined with sort of imperfect epidemiological information.
So you are obviously, yeah, you're involving from the start the stakeholders with this engagement process. I suppose there are lots of policymakers on the call. I mean, we've got, even on the dengue advisory group that you're on, we've got the Ministry of Health Pakistan, Ministry of Health Saudi, Ministry of Health Sri Lanka, amongst others. And certainly in this particular 3-day forum, I mean, tomorrow there's the Indonesian Minister of Health himself giving an address regarding all of this. And we've had various, earlier just before this session was the Pakistan government's own symposia. And so we've had lots of different inputs from different kind of ministries as well. So lots of policymakers have joined in. What I wanted to ask you is, do you feel that you have good communication channels with policymakers whilst they're tuned in, whilst they're listening, to meet their needs? Could this be improved? What would be your message to them? You know?
Yeah, I think it's very much about sort of, listening and understanding, not asking necessarily what you need, but what do you do, really trying to understand those decision-making frameworks and the timeframes. When are the fiscal decisions made about when to intervene, how much lead time is needed, what's too long, what's too not long enough, understanding those spatial scales that are needed, and also communicating well the limitations of the models that we develop, and all the uncertainty surrounding that, and incorporating that uncertainty into sort of the way we communicate our forecasts. So I think it's very much, yes, it's about co-development and co-creating like services, but very much developed in collaboration with the people who are going to be using them.
So I hope any policymakers listening to that are, taking heed of that, and I hope there is a kind of a move forward from this particular session, because it's simply amazing work that you're involved in. We've had some great feedback from the audiences all the way through the presentations, super presentations, exciting work, all of it. And there's a couple of questions, Rachel, for yourself as well. That's come through from one of the attendees who hasn't given a name, unfortunately, but can we incorporate entomological data into your forecasting models?
Yeah, absolutely. So the kind of models we develop are very flexible and they can incorporate any sort of space-time information. So it could be just a spatial layer, it could have sort of annual or finer resolution. So if entomological data is available, we could certainly make use of it. We could use it to sort of, if it's not available for your whole geographical area or it's just a particular time period, we can use it to sort of improve estimation in that particular area. If there's a live stream of that data, then we can also formulate models to predict the vectors themselves. So it's really just to do with data availability, how real time that data is, because when it comes to prediction, the reason we tend to fall back on using forecasts of the climate is because that's one area of predictive modeling that is very well developed and gives us predictive lead up to around 6 months in advance. So that's where we can explore extending our lead times, and it's quite difficult to be able to predict with other data streams.
That's a great answer, and hopefully that answered the question for the attendee as well. I'm sure it does, and potentially even opens up doors for Frederik's global vector hub to incorporate this type of these kind of communities into that hub, so these kind of exchanges can happen. There's a question that's come through from Catherine Brown for you, Rachel, as well, which is, are you incorporating flood modeling into any of the predictive dengue models that you've described?
We haven't done so far, but we'd very much like to. I'm working at the moment with MSF, looking at trying to develop flood modeling into predictive models for malaria. In India and Sudan and other sites that they have. So it's definitely something we're very interested in looking into.
Well, that's a great answer. And I hope, I hope Catherine, you're one of the attendees. Thank you for the answer, and I hope you can get in touch with Rachel directly around that question. And that'd be great to see. There's also some questions coming through from Dr. Ivana Haluskova-Balta. Well, there are quite a few statements. One of the questions is really about, well, she's asking quite a big question actually. Would you agree to incorporate this global health issue in the Glasgow agenda in 2020, the COP 2016 that's coming up in November? Is dengue in that agenda? I mean, I just answer that very, very quickly before anyone else has a go at it. We are actually planning 2 side meetings at COP. One will be with NOMA and the other will be with dengue, but we're just kind of getting those off the ground at the moment. But we are actually planning to push that onto it. I suppose one of the things I wanted to ask you, Rachel, are the challenges. Only yesterday, the Swiss, as I'm sure you've seen, the Swiss had the referendum question on climate change, an act at national level, which was rejected slightly. It didn't pass by the public. And there does seem to be some kind of reticence. I mean, the G7 could have explored climate change more. There are these cuts in the background. What kind of challenges do you think you're going to face? Not pushing, but putting this type of approach into a more central role in terms of combating dengue.
Yeah, I certainly think that there needs to be more work to put health at the forefront of climate change action. I would say there's been some positive movement from the Lancet Countdown on Health and Climate Change, which does some pretty strong sort of policy and advocacy work every time the annual report is published. And we're now developing more regional reports. So we're putting together the Lancet Countdown for Europe right now. And yeah, I think there needs to be sort of a big push to really make sure that everyone is aware about how the negative impacts of climate change and how they affect everyone everywhere.
Great answer, and thank you for that, Rachel, indeed. so I suppose moving to Frederik, there's some kind of opening there. There have been great responses to all three presentations, as I've said, and in particular yours, Frederik, in terms of great website. I'm sure people are going to be logging onto that. We ourselves, we had a weekly broadcast called ISNTD Connect, and that was some time ago, almost a year ago, where we had, in coinciding with the beta launch of the site, Frederik gave a very interesting hour-and-a-half session with Q&A from the audience back then. So you're all welcome to have a look at that on our site. And I'm sure that the way that you're moving in terms of the iteration of the site and the launch in July of the second version is going to attract a lot of attention. We've had, you mentioned one of the partners. There was a slide, Frederik, that you showed, and on there was APMAN as well, the Asia Pacific Malaria Elimination Network. We had a session with APMAN, UNICEF, and Rollback Malaria a couple of weeks ago now, and that was looking on World Nutrition Day on the 28th of May, and that was looking at the kind of how to bring the nutrition world, the nutritional deficits in malaria. So that actually did a cross-sector kind of collaboration between malaria and nutrition. Your hub definitely seems to have the capacity to support cross-sector approaches. And so I guess the question I wanted to ask you, there is a question, the question was this, that it seems that entomology itself, should there be a different way of teaching entomology, Frederik? Should this be embedded across different sectors, potentially? Should entomology or entomological considerations, parasitology, be embedded within different kind of disciplines? What's your take on that, Frederik? Given that you're making this hub with lots of different inputs, it's a big question, but over to you, Frederik.
Yeah, thank you. That's a really good question, and obviously, as someone with an entomology background, I'm severely biased here. So yes, I think everyone should be always enthusiastic and interested in insects. What I do think is one of the main challenges in controlling vector-borne diseases, and particularly arboviral diseases such as dengue and Zika and chikungunya, is what someone described as wicked problems, because they're so complex and they really involve stakeholders from so many different groups and backgrounds. And it's always been a challenge of reaching out to everyone who's involved in the decision making and educating them, but also finding the right level of information to their needs and their knowledge. Let's say someone who's a very busy minister of health in a country, they will not have very much time to discuss, let's say, the finer details of the neural structure of the antenna of a mosquito, let's say Aedes aegypti. But they would want to like to know the really general, the need for what specific recommendations should they be taking for their country. For instance, if there's been a predicted dengue outbreak a couple of months down the line. Same for other ministries, and what we observe is really this sort of formation of silos where people just don't talk to each other. When we talk about ministries of health, but also of agriculture, who may be much more involved in some countries in the business of pest control, but also tourism, which is, again, take Barbados, for example, most of the other Caribbean islands as well, where such a large proportion of the business of the economy is supported by tourism, and that itself is affected by any disease outbreaks, let's say Zika or dengue or chikungunya, that there needs to be much more awareness. And this can really then go down to individual hotels that may be involved in sort of sensible planning of their landscapes, of their gardens, and to avoid and reduce breeding grounds for mosquitoes, or really having a integrated vector management plan built in. So I guess the earlier you can start educating everyone who's involved, who may be relevant for the control of vector-borne diseases, the better. And I think that then is really just the challenge of finding the right breadth and or depth of information, and the right to engage with the stakeholders.
That's a great answer. And given your work with the WHO's TDR, this training gap that you've seen and you're addressing with your training programs through the TDR, the WHO's own roadmap to 2030 guidelines for the new guidelines until 2030 for NTDs, and dengue is in there, is that one of the key strategic shifts is this whole move from the rhetoric around multidisciplinary research into a real multidisciplinary format, so involving different sectors all the time. So perhaps that would actually play to that in a very good, in a very strong, supportive way, which can only be a good thing for the various communities in and around this area. Example of that, we've had one of the attendees send a question in, Dr. Christophorus Hendra Dijia, vaccinologist, Dr. Christo from Indonesia. And Dr. Christo is asking, are there any resources about vector disease vaccine development across the world or courses around those topics in the platform, Dr. Frederik?
Thanks. At the moment, there are none, simply because we've very much focused on the vector side. But of course, we are very much aware of the different aspects, and vaccines, as has been shown throughout the pandemic now, do play a significant role in controlling the diseases. And obviously, in addition to the entire complex of dengue vaccine development, there have also been very other promising developments in the last few weeks and months. You've probably all read about the phase 2 trial results of the malaria vaccine in Africa that look very encouraging. I've also just seen that Valneva is recruiting for the phase 3 trial for chikungunya vaccine, so this should be really promising. And I think, so this is really something we are always very open, and in the future would be very keen to develop this further. Yeah. One other aspect we should also keep in mind, however, that it can also work in both ways. So we've been in touch with the Eliminate Yellow Fever Epidemics initiative based at the WHO, and obviously yellow fever is quite a different beast in terms of mortality, but also its prevalence is quite focused at the moment, at least in some African countries and in Brazil. Fortunately, it's not yet, hasn't occurred yet in Southeast Asia, and there is a vaccine. However, even if you have the vaccine, you need to be careful because of the lag until the vaccine really kicks into effect. So we would always advocate for not just relying on any vaccine as a single solution, but always keeping integrated vector management as a key component of any disease planning. Outbreak planning. Thanks.
That's a great answer. I mean, we've already seen how important the deeper insights into pathogenesis are over the last few days. And I'm talking about host vector interactions in themselves. So perhaps having the ability for different sectors to attach to your global vector hub, cross-pollinate ideas, is only going to be a good thing, and long may that continue. And we really wish you all the success in the world with that. It's very much needed, this lingua franca, this common language between various sectors. And I think you've got the ideal platform for that. So hats off to you for that, Frederik. We've had one more question, just switching back to Richard for a second. Richard, if you don't mind, we had a question again from an anonymous attendee. Sorry, your name hasn't come up, so I apologize to the attendee there, but it says, for Richard, have your products been assessed for control of West Nile virus? So outside of dengue, but within the same kind of family?
Yeah, no, good question. The answer is, as far as we know, nobody has tested them yet for Culex mosquitoes, the principal vector for Western Nile virus. I think it's sort of the research that should flow naturally off the back of the sort of work we're doing now. Once we get a result that's clear when we're looking at multiple vectors, I think that's normally the thing that will spur people on. Obviously, it's hugely relevant for countries like the States, where Western Nile virus is important, and protection in parks, which currently relies largely on fogging, is obviously a sort of right place for evaluating that. So not yet, as far as I know.
Okay, a great answer. I'll leave with this kind of question from Dr. Ivana Haliskova-Balta. She's asking in one of the things she's posing, how are surveillance, and this is all three panelists, in terms of your own work, how have surveillance structures such as the ECDC, the European Centers of Disease Control, African CDC, the ASIA, so the ASEAN member state CDCs as an example, or ministries of health, how have they been involved in providing first-hand online data? Has that been I don't want to put anyone on the spot, but in terms of difficulties in the end, but how are they involved? They're involved directly with your work. So I suppose I'll ask Richard that first, just because you're there.
Sure. What we find pretty much world over is because of the nature of the settings we're working in, where generally breakdown of health systems and surveillance systems is pretty much ubiquitous across these settings. Data is pretty poor. Usually access for most of these events that happens, it's happening in places which were not really highly populated before necessarily, and they might have been marginalized and resource poor. So getting good data certainly for the research side of what we do and for the surveillance side really depends on us setting up good training for health workers using good reliable diagnostic tools, which for several of the Aedes-borne diseases is particularly challenging because the diagnostic tools are not as simple as they are for malaria, neither to use nor to assume accuracy of. So there's still a long way to go. And it's actually a reason why in Yemen, all of our studies there are based on entomological monitoring data rather than epidemiological, because we don't have the capacity with the ministry there to obtain reliable dengue confirmatory diagnosis. And that's a frustration for many parts of the world, is lack of reliance or reliability of the diagnostic tool on which all surveillance then depends. So beefing that side up is a really critical part for beefing up good surveillance data and its reliability.
That's a great answer.
No shortage of willingness for partners to work with us, though, and we find them very collaborative and facilitating as far as you can be with such a newly challenging disease in the places it's spreading to.
Thank you for that answer, Richard. To Rachel, perhaps, obviously you've mentioned that in your slides as well, but this is just to give the attendee, Dr. Balta, an answer in terms of surveillance structures such as the ECDC, African CDC, ASEAN member state CDCs, ministries. They're involved in providing in your work.
Some of our projects have involved accessing sort of the online data from either, there's the PLISA platform from PAHO, the Ministry of Health. We tend to rely on the DataSeas platform from the Brazilian Ministry of Health to access dengue data for Brazil, which has been a very useful source of data. Most of our work, we've been working directly with someone at the Ministry of Health who's given us sort of longer records. For example, the PLISA data tends to just go back to 2014, and usually we need, the longer the records, the better to develop the statistical models. So we tend to be working a little bit more directly with someone who's actually in country. But for more sort of large scale studies, we have used data that we've been able to scrape from the internet from the different ministries of health in Latin America and Southeast Asia.
Brilliant. Thank you for that answer, Rachel. Thanks. And I know you alluded to a lot of the different data sets in your presentation as well. So it's interesting to see that spread outside of the kind of traditional surveillance structures that Dr. Balta is referring to. So thanks for that answer. Frederik, with you, you mentioned the lack of interest in neural structures for antennae in mosquitoes at government level. Do you anticipate that changing in the future? Can you see them being involved in terms of giving you data or inputs into your global vector hub?
Yeah, thanks. I mean, in the longer term, yes, I still am incorrigible optimist, and yes, I do hope that we can reach out to enough relevant ministries and convince them of the benefits of making data more accessible, not only to us but also within say, a government or really breaking down silos again so that different stakeholders within the government can access this information more easily that they may otherwise perhaps not even be aware of. And of the specific organizations that were mentioned in the question. So we have been in touch with ECDC. We have, together with EFSA, the European Food Security Authority, they have created the VectorNet platform, and they do collate vector surveillance data on a higher level across Europe. So these are really down to municipality level or higher administrative level. And I think it shows definitely the mixed structure of data availability, even across Europe. So there's a lot of simply data is unavailable, as in there's no systematic vector surveillance in place. So what we're doing at the moment is we're doing some landscaping and assessing the situation across the globe, particularly in South America at the moment, and then moving on to other continents. And I think then in the longer term, it would be really helpful to get more and more countries or other stakeholders together and then really convince people of the benefits of making the data accessible. Having said that, we're also very mindful of the ownership of data, and we don't want to come across as someone who just, particularly from a high-income country, grabbing the data and without acknowledging the proper ownership. I mean, especially if you look at low-income countries where the staff that has been really undergone all the training, they've gone out to conduct the surveys. They're the ones who set out the traps and check them. They enter the data manually in a very laborious way. So we want to make sure that these people are really truly acknowledged, and we're always open for discussions to how to address this in different ways. So we don't want to be seen as the one and only solution, or we have the only solution, and we're always open for discussion. Thanks.
I'm sure by addressing these ethical considerations that you've highlighted in terms of data ownership and all of this, you'll very quickly rebalance the North bias, as it were, or the thing that you mentioned at the beginning of your talk. You want to encourage more South, global South involvement with your tool. So, you know, I'm sure that once I'm sure you're addressing those ethical challenges, and that will help you to bring that balance back in terms of users of the global Vector Hub itself. So it's a great answer. Thank you very much for that. I'm very wary of the time. I'm being asked to kind of truncate this, and we've gone 10 minutes over. Some fantastic Q&A interaction from the audience. So thank you very much to all the attendees for interacting there. I'm sure you're able to contact our wonderful panelists who have given a lot of their time today to not just talk about their work, but to kind of answer your questions and kind of further push this discussion around dengue towards solutions. That was one of the pivots we wanted in this session. And I think that's been beautifully delivered by this session because of the work of the panelists and the way they had that solution optic ready to hand. And it kind of fills you with a bit of excitement for the next few years, how these, in particular, these three approaches are going to evolve. We'd love to have a time machine and come back in 5 years and see where we are with that. Maybe we'll be having a dengue forecast or a vector-borne disease forecast at the end of the news, at the end of the national news with their weather bulletins in the future. Who knows how this is going to evolve, but it's certainly something that needs, all of these projects need to be considered. These approaches need to be brought way into the mainstream. I do feel that's going to happen moving forward. So thank you a round of applause to our panelists, to Rachel Lowe, Dr. Rachel Lowe, Dr. Frederik Seelig, and to Richard Allan from the Mentor Initiative. Thank you very, very much for your time.